Well, tonight we get a better understanding of what those sickened with COVID-19 go through. This after 2 local patients were recently sent home from the hospital after battling those complications. Q2's Andrea Lutz reports.
Health professionals are giving us a better understanding of how COVID-19 can impact those in our community.
They would say that it's the worst. It's a combination of the worst cold and worst influenza they've ever had.
Nancy Iverson specializes in infectious disease at Billings Clinic. She spoke with me about how patients she meets with are faring with the virus.
And then it's a cough. And when I've talked with people on the phone, they sound like they have a bad cold. And they sound like it's many people that it's in their chest.
She says the virus affects the lungs and people's ability to get oxygen, but that a cough can be prolonged because of the damage done by the virus.
Many patients are able to go home. They're very tired. That's another complaint we're seeing is they're extremely tired and they sleep a lot.
But there's this. Patients in our community are experiencing a mild to moderate version of the disease, meaning many don't need hospitalization. Yet symptoms can change, and quickly.
Typically, if you get a cold, it maybe doesn't keep you from getting on an airplane. It maybe doesn't keep you from going to, events, weddings, birthday parties, funerals, all of which we're reading have been transmitting COVID to other people. And unfortunately, some people acquire this viral infection and don't do well and get very critically ill and have died. And that's tragic. Other people are experiencing it differently.
Recently, a Billings Clinic patient returned home after being hospitalized and placed on a ventilator. Another at St. Vincent also recently went home after spending a week in the hospital.
I don't think we know yet how it's going to come into our community. It's here. We're learning to live with it. We've had members of our community very ill. We know we've lost 6 Montanans who died from this virus. So I think it's balancing the seriousness of it and how it affects certain people. I think we have some control over how it plays out in our community.
Iverson says perhaps the biggest takeaway for everyone, respecting the virus. In Billings, Andrea Lutz, MTN News.
Thanks so much, Andrea. Now, the 2 patients Andrea mentioned in her story are among the 28 Montanans who've been hospitalized for COVID-19 since the start of the outbreak.